You know, one question, certainly a lot of kids, their asthma is being taken care of by a pediatrician or a family doctor for diagnosing these kinds of allergic asthma and those triggers. Is that something that a pediatrician or family doctor can do?
Well, that's a great point, Lisa. Actually, it turns out that a very high percentage of asthma patients will not wind up seeing a specialist, an allergist or a lung specialist. Uh, 60 or even 80% again of patients are taken care of at the primary care level, as you suggest, by their pediatrician or family physician. In the case of children, by their family physician or internal medicine doctor if they're adults. And so we really need to put good diagnostic and therapeutic tools in the hands of primary care clinicians since in many cases, as we say, the specialist won't be involved. And fortunately now we have very good, simple blood testing to identify allergic triggers in asthma. It's not necessary for every patient to go to the allergy specialist and have traditional skin testing. Simple blood testing can be done and sent to the laboratory and results be back in a day or two. And a doctor and a parent can know right away which allergy triggers are most important for that child. Not just assume that it's the cat or that it's the weed pollen that's in season or that it's the house dust mite. It turns out that most allergic asthmatic patients have more than one trigger. So we talk about a sort of threshold effect where the triggers and the insults sort of pile up on top of each other, and you have allergens, and you may have viral infections, and you may have irritants like air pollution or cigarette smoke playing a part. So all of these things can get together to make it more likely that an asthmatic patient might have an exacerbation of symptoms and might make it more difficult to control. So the allergens, we can control exposure to many of those. We can reduce exposure to house dust mites in simple ways like covering bedding with allergy-proof casings. We can sometimes reduce exposure to pet danders, to cats and dogs by getting them out of the bedroom or even sometimes maybe out of the house for the most part. Obviously, most families don't want to be told to get rid of their pets, so we try to work with them to just reduce the exposure, particularly in the bedroom. It's been shown that if you can identify the appropriate triggers for the child or adult and then set about to reduce exposure to those in the bedroom because we spend so much time there, it's very effective in terms of decreasing asthma symptoms and improving asthma control. So again, the bedding coverings, sometimes mold is an issue in the bedroom or in the bathroom, and controlling humidity in the bedroom and the bathroom are very important to decrease exposure to both house dust mites and to molds. Again, the approaches to pets. Many times, asthmatics will also have seasonal allergies, weeds, trees, and grasses, and to some extent molds are seasonal. So we think that it's easier in some cases to control the indoor allergens, but there are also simple things that can be done to control pollen allergies. Certainly use of air conditioning in cars and houses can help. But simple things like washing your hair before you go to bed at night if you're allergic to pollens. If you think about it, your hair is something of a pollen collector all day long, and if you go to bed and put your head on your pillow, you've got quite a reservoir, a storehouse there of pollen that can contribute to nighttime symptoms. So if you just do a simple hair washing and shower at bedtime, that can really clean the pollen out of the hair and off the body and really improve the symptoms from the pollen allergies.
Wow, I really never thought about that.
Most people haven't. Yeah. Yeah.
I will have to remember that, definitely. Um,
Yeah.